Dr. Navneet, while everybody's typing in, would you, you talked about the quality of sleep, but I think a lot of teenagers would agree that even if they would want to sleep at a certain time to make the best out of it, the schoolwork is so much, so enormous that they usually just cannot go to bed at a certain time. So they usually get.
They're also very demanding and quite stressful. And I think a lot of the kids that I see are high achieving, which is great. But you're absolutely right. It's hard by the time that you finish school, do your extracurriculars, come home, eat dinner, and yeah, I mean, if you want to do well in your coursework, just staying up late. I see a lot of kids who are sleep deprived, exactly as you said. Again, I think the online learning that's happening right now is really variable from school to school. I think in a lot of cases, the amount of online learning may not be as much as what kids would normally go through in a regular school day. So, personal example, I know my older daughter who's a junior this year, she has a maximum of 3 hours of online learning per day. And again, I'm not saying that all kids are like that, but I do think it does open up time for at least most kids, I think these days, to hopefully have some open time, and hopefully if they have more time to be able to get their homework done, that will then allow them to sleep on time. But it just goes back to my important point about routine, because I think what's very easy to slip into is almost like a vacation mode where you're sleeping late, waking up late. So we know that's not healthy. So I think it's important to, again, use this as an opportunity to try to get to sleep on time. Allow yourself to sleep in a little bit, just like we do on weekends, but it should ideally be no more than about 45 minutes to an hour later than what you would normally wake up at.
All right, all right. And we're looking at about 7 to 8 hours for teenagers.
I'd say ideally 8 to 9 hours, but yeah, we'll take 7 to 8.
8 to 9. Okay. And how about the younger ones, the elementary kids?
Yeah, so for elementary kids, again, so much science that we're finding out in terms of the importance of sleep. So sleep is when what's a lot of called consolidation of learning is thought to happen. All those things that kids are absorbing during the day, those synapses are firing, things are getting consolidated. So really important, for all that development that kids are going through, for them to get, again, a good amount of sleep, a good quality of sleep. So I'd say for the younger kids, if they could get like 10 to 11 hours, that'd be great.
Right. And Dr. Naveed, there's a question about whether if you should be in contact with pets if you are likely to have COVID-19. Are we advised to stay away from our pets during that time?
So the question is, if someone is infected, if they're a confirmed infected case, should they stay away from their pets?
Mm-hmm.
Yeah. So again, this is a lot of what we're learning about this virus is emerging, because this is, again, a novel virus. We're getting more and more epidemiologic data, longitudinal data. I do remember reading about a case of a tiger that was infected with COVID-19. The zoo caretaker had it, and the tiger tested positive as well. From what I recall reading, the tiger was asymptomatic. So maybe pets are like kids, and they tend to have higher rates of either asymptomatic or mild disease. So that's a good question. I have a dog at home that I love dearly, and I'd want to make sure that he stays healthy. But yeah, I think at this point I would say it's fine to be around your pets.
Okay, so we do have another clarifying question for you, Dr. Navneet. I'll read out the question for you. Does the transfer of COVID-19, it's regarding that. I know a lot of my friends are really paranoid, in particular about touching doorknobs, etc., and then touching their friends. I'm really cautious of that as well, but obviously it can be very anxiety inducing to be hyper aware of these circumstances. I wanted to confirm that the transfer is only successful if the virus reaches your respiratory tract system.
Yeah, that's an excellent question. So, there were articles that came out. There was, I believe, a New England Journal article about where they talked about how long this virus lasts on different surfaces. And I think that did create a lot of anxiety for a lot of people, myself included. Where they talked about how it lasts on plastic and cardboard and metal. And, you get to a point where you just kind of feel like you can't touch anything and you're washing your hands every seconds. I think the important point to make with that is that, first of all, we know that this is passed through respiratory droplets. So just to kind of talk a little bit more about that. some viruses are passed airborne. So example is measles virus. So if someone came into a waiting room in my clinic and had measles, they were breathing it. It's going to linger in the air for several hours, maybe a few days. But with this virus, we know it passes from respiratory droplets, which means it comes out and then the heavier particles fall down. The lighter particles may stay in the air for a period of time. So, primarily the risk of infection is if someone who is actively infected or asymptomatic, but, basically has an infection, is within 6 feet of you and coughs or sneezes, and, that's the main way that you can get sick. The other way that you can get sick is if you touch something that has the virus on it and then also happen to touch your face. But, it's important to keep in mind that we all touch our face way more than we realize. A lot of us touch our face without realizing it. We're right in the middle of allergy season right now, and a lot of people have itchy eyes or itchy noses. We know that sometimes people bite their nails. Younger kids suck their thumbs. So all of those things, can lead to transmission of the virus. But again, it's important to kind of realize that just because you touch something that, let's say 3 days ago had a virus, on it, and it still has some of the virus, it doesn't necessarily mean that you're going to get infected, because it's important to understand that there's things like viral load and viral half-lives. So just because you touch the virus and it's on your skin does not mean that necessarily the virus is of a significant enough burden to actually lead to infection for you. So again, I think the most important thing is just going back to what we've all been hearing time and time again, which is lots and lots of hand washing, especially if you have touch things like, doorknobs that friends have touched, or, you're picking up packages that got delivered. You've gone to the grocery store, obviously, anything where you've touched things that you might have contaminated your fingers. And then, because again, who knows if you'll accidentally touch your face, make sure that you wash your hands and make sure that you try to avoid touching your face.
I think it answers the question, because there was another question which said that, they wanted to confirm if we do touch a doorknob, wash our hands, and then go to touch those who are quarantined with, will they be okay? So I think you just answered that question about how frequently is it required to wash our hands.
Yeah, so if you are in a household with someone who's been tested positive for COVID-19 and is quarantined in the house, hopefully they're in their own bedroom and using their own bathroom. Of course, you're not sharing food, and they have their own towels and all that kind of stuff. Obviously in a situation like that, physical isolation to the degree that's practical, but also being like extra vigilant, I'd say, about hygiene.
And Dr. Navneet, there's a question regarding if the kids have mild fever or runny nose or just throat infections, and the parents are not too concerned about COVID-19 for them, but should they be avoiding the hospitals at this point?
Yeah, that's an excellent question. So we as a pediatrician, I get phone calls, emails every day from parents whose kids have mild symptoms of being sick and they're not sure if they should get tested, if they should come into clinic. I'd say at this point, in general, we're recommending to try to avoid clinic visits if possible, just because of social distancing and shelter in place. And when you go to clinic, there's always a chance of getting exposed. And in terms of getting testing done for a situation like that, as a doctor, one of the things I always think about is when I order a test, is it going to change my management for my patient? So, I think from an epidemiologic standpoint, I can certainly understand that, the more tests that we had done, the better that we would understand this virus and therefore be able to contain it. But from a management standpoint, if a child has fever and runny nose and cough, but they don't have any shortness of breath or difficulty breathing or lethargy, it really doesn't necessarily make sense for them to get tested, because it's not going to change what we do. Other than the fact that, we'd recommend that they stay at home and be quarantined, but with shelter in place, we're kind of recommending that anyways. So I think the bottom line is, if your child has mild symptoms, I do not think that they need to come into clinic. I'd look out for, the normal things that we look out for any viral infection, including influenza, which is cough that leads to heavy breathing, fast breathing. If your child is lethargic, if they're not urinating very well and dehydrated, if they have a fever that goes on for more than 5 days, because with any virus, usually the fever should get better within 3 to 4 days, maybe about 5 days. So I'd say those would be some of the indications.
And there is Hari from Jaipur, and he wants to know if there are any things he needs to do to avoid fear among his kids.
Yeah, that's an excellent question. So I think it's really important to just make sure that we get a chance to talk about these things with the kids. And, I think one of the most important points that I can make in terms of parenting is validation. I think it's really important for kids to understand that they have feelings like adults do and that those feelings matter. So before we try to, I think, educate our kids about this virus, just acknowledge their feelings, say, hey, I know that this can be really scary, or, you look like you're worried, or you look like you're nervous, or, that kind of verbiage where you just let them know it's okay to have these feelings and you understand that they have feelings. And then from that point, try to guide them through that. And, I'd say, especially for the older kids, it's important to do a lot of open-ended questions instead of just instructing them. So, once you've validated the feelings, say, tell me a little bit more, or what are some things that you've heard that are scary, or what are some of the things that make you nervous? Do you worry that, your mom and I are going to get sick, or your grandparents are going to get sick? What are your thoughts about that? What have you heard from other kids? How do you feel about the fact that you can't see your friends? For seniors, how do you feel about the fact that you can't go to prom, you can't go to graduation, you can't go visit these colleges? I think it's important for us just to touch base with our kids. So validate, and then be inquisitive, be curious, try to draw out their concerns.
Right. Dr. Navneet, there's another question. It's apart from social distancing, should we as a family take any supplements for prevention, specifically for COVID-19?
Yeah, so I think, this is definitely a good time to practice good, healthy habits in terms of, how we eat and exercise and sleep well, because those things in general are just going to optimize our body, especially during a time like this where there's a really, significant virus that's there. So Ankita, you know all about the importance of nutrition and how it really helps boost our immune system. Again, I'm going to harp back to sleep. I think sleep is a really important way that we can keep our bodies functioning in an optimal function. And then, again, exercise. So great opportunity to really emphasize those things. I don't think there's any quote unquote supplements that you need to take per se. I would just try to eat, as you know, Ankita, it's good to get these things from natural sources. I'd love to get your take on the nutritional aspect, but I always tell families, our bodies are meant to get the vitamin C and the zinc and the vitamin D from natural sources. That's how, we're designed. But if for some reason you feel like you're not getting those from natural sources, certainly taking a supplement. But I would love to get your take on that too as well, Ankita.
Oh, definitely, Dr. Navneet. I think I would die, it's just everybody, the shelves in the supermarkets are full of all these supplements, and everybody's all the time debating which brand to buy, and you have to check the labels, how much sugar is added, what are the different preservatives added to those. And like you said, if we stick to natural whole foods, our bodies absorb them better, and we reap the benefits for years together instead of just popping a supplement, and having vitamin C, which helps your body absorb iron. So we want to keep in mind that we're eating the right kind of food, we're eating vegetables and fruits, and that's complementing the body throughout.
Awesome. Yeah, that's a great answer.
Right. Dr. Navneet, there's another one which is very close to my heart. This question is it okay to bring a new pet in the house in the current situation?
For sure. Again, I'm going to be very transparent and say I'm biased in my answer because, again, I have a dog that I love dearly. And, again, there's real medical research that shows that having a pet actually decreases blood pressure, decreases stress and anxiety, decreases the rates of depression. It's been shown to prolong your life. So I know I've been especially grateful to have my dog during this period of time. Again, it's, I think, great that people are thinking about, bringing a pet in the home at this time and, causing them any potential harm. But again, I think at this point, there's so many benefits. And, I think it is honestly a good opportunity to have a pet in terms of the fact that everybody's at home and you can really work on, that house training. So maybe a good opportunity.
Right. Yeah, I would completely agree. And Dr. Navneet, there's another question. How can we minimize screen time or phone time for teens? They need friends to talk, but it means more screen, more phone time, other than that they're all the time either studying or chatting or texting.
Yeah. So again, I'll speak not only as a pediatrician, but as a father. Again, I have a 16-year-old and an 11-year-old at home. And, this is something that we grapple with on nearly a daily basis. So one of the points that I'd make is to the person asking the question, you are not alone. This is something that, I think parents are really trying to navigate. And I think the reason for that is that when we grew up, we didn't have to go through this. I know when I was growing up, I either watched TV or did homework. So my parents didn't have to kind of figure out all this other stuff. But, I do think as a pediatrician, it's important to view these things through the lens of the child. And one of the things I think we need to remember as parents is that teens have way more options to be distracted than we did growing up. So, again, I had my TV. My teenagers have their phone, they have their tablet, they have their computer, they have their video games, they have Netflix, they have YouTube, they have, Snapchat. Right. Instagram. So, I think it's important for us to kind of just empathize, with the fact that this is really tough for kids too. And, it's important for us to remember that media technology is made to be enticing. All these companies want you to use their product. And so it's tough. We know from research that's been done that when you start using technology, you lose track of time. So, sometimes we get frustrated with our kids because they've been on their device for so long, but they don't know they've been on their device for that long. So, again, I think just see things through their eyes, realize it's a tough time for a lot of parents, but also for them as well. The other thing that I would say is that I think it is important to be a little bit more flexible at this time, just because they are at home more. And again, I want to just get back to the fact that social relationships are very important for our teens. And I think it's important for them to feel like they can stay connected. But all of that being said, at the same time, I think it's important to make sure that there's balance. So one of the things that we've tried to do with both of our kids is to say, can you please tell us every day when you're going to exercise, when you're going to shower, when you're going to have some time to do some reading? Can you please tell us what time you're going to try to go to bed? So that there's at least that expectation that, those things will happen. And, again, I think if you start asking your child to help out in the house, so if they're doing some of the laundry, if they're doing some of the cooking, if they're, taking out the trash, I know this last weekend in our family, that was when we did our kind of deep clean in the house because our cleaners aren't coming anymore. So it's the first time that my kids actually had to clean their bathroom and, that kind of stuff. So I think if you try to make sure, I think oftentimes we're focused on making sure that our kids aren't doing things like technology, but if you carve out time for things that you would like them to be doing, like exercise and like household chores, I think that will help. And then the other thing that I'd say is, again, and I know this is not easy, but get into dialogue with your kids instead of just saying, you shouldn't do this and I don't want you to do that and why are you doing this? Get into a conversation because I think youth, and I know there's a lot of youth that are listening, I hope that they will, agree with me. Youth, I think, appreciate when their perspectives matter and when their voice is heard and when they feel like they are part of the process and when they feel like parents are collaborating with them rather than kind of a top-down approach. So, some of the dialogue we have with our kids is, well, what do you think is an appropriate amount of time to be on technology and why do you think that's appropriate? And what do you think are some of the ramifications of using too much technology? But also, what do you enjoy about technology? What are some of the things that you're looking at? Show interest in that. Tell me this game that you're really into playing right now. But another thing that I'd say is, role model the behavior that you want to see in your kids. I think it's important for us as parents, if we are going to try to teach our kids to be disciplined in terms of the use of technology, you got to walk the line. I think you have to show them that you have the discipline too. So, show them that there's periods of time where you put down your phone. Family time, really should be a time where nobody's on their devices. If your kid comes up to you and is talking to you, if you can, put down your device, give them the attention they're looking for. I think it's important for us to role model the behavior we want to see in our kids.
Perfect, Dr. Navneet. I loved your answer because you're emphasizing to have a schedule and not to worry too much that why they're doing it, but just find a very healthy way to tell them, oh, there are other things to be done. And instead of telling them why they shouldn't be doing something. Just help them do something more constructive, which will take them away from the screen. Perfect.
Yeah.
Definitely. There's another question about the healthcare side of things. The question is wondering how those that are low income or less privileged are being taken care of or considered from a healthcare perspective.
Yeah, that's an excellent question. I think in this country where, unfortunately we don't necessarily have universal health care, it's really important to kind of think about the people that are more marginalized. My 11-year-old daughter, I was so impressed the other day, we were walking the dog and she said, what's going to happen to all the homeless people? I was like, wow, that's totally true. They have no way of doing social distancing. They don't have hand sanitizers necessarily. They can't wash their hands. So it's important for us to think about like other people in our society. So I applaud whoever asked that question. I will say that here in Santa Clara County, we have a county hospital, and I rotated through the Valley Medical Center when I did my residency training at Stanford. And, at that clinic, nobody was turned away. So if you had health insurance or not, if you were a citizen or not, everybody got care, whether it was being seen in the ER or even just families that came in with their babies for well child visits. So the bottom line is, I think at the local county hospitals, everyone should be able to have access to medical care.
The same lady has another question which says, what sort of vaccines are we working on creating? She says that she has read a couple of things suggesting that people are considering creating a universal flu vaccine. Is the vaccine we are working on for COVID-19 geared towards this infection in particular, or the general flu?
Yeah, that's another excellent question. I can't say I have an exact answer to that. I will say that vaccine development is well underway. I think the pace at which research is being done on SARS-CoV-2 is very, very fast. There's multiple centers in multiple countries that are working on this vaccine. I think a lot of what I've read has said that the two main things that are really going to help us to control this pandemic are testing. So we really have a sense of who's infected and, the epidemiology of this virus, and vaccine. I think those are two of the primary things for containment. In terms of the vaccine itself, I don't know, honestly, if, the vaccine is kind of like a flu-like vaccine. This is a different virus than influenza virus, although, as I said at the very beginning, they both, can cause a lot of morbidity and mortality. But I'm not honestly aware if the vaccine is, kind of prototyped to be similar to the flu vaccine, other than the fact that, it is something that I think would be recommended to be given on a widespread basis.
And Dr. Navneet, there's another question. Is it okay to wear a homemade mask?
Yeah, so again, we're, I think, learning more and more about this virus as we have more data on it. Of course, as many people know, initially when people were thinking about wearing masks, whether it's a cloth mask or a surgical mask, the recommendation from the CDC was it's not necessary because it's not really going to help you from getting infected. But I think one of the things that we're realizing more and more is, again, in terms of transmission, is people that are asymptomatic who are spreading this infection. And wearing a mask, if you're asymptomatic, is a good way to try to prevent other people from getting infected. So that's just in terms of masks in general. So I think if one of the primary reasons for wearing a mask is to not spread the infection, then I think a cloth mask would be just fine.
Perfect. Thank you so much, Dr. Navneet. I think those are all the questions that we had.
Yeah.
And thank you so much for all your time.
Of course, my pleasure.